Hello, my name is Ken Robel, and I'm Vice President of Academic Affairs at Salem Community College. And we're here today with our conversation about men in the nursing profession. And I'm here with 5 successful nurses, and I'm going to give them a chance to introduce themselves now. So let's just go down the line. Please introduce yourself to our audience.
Hi, I'm Alex Lamp. I have a bachelor's degree in nursing from Rowan University. I've been a nurse for 4 years now, and my main area of work is in psychiatric.
Christopher Lugo, working on my BSN through Rowan University. Graduated in 2017. I've done a lot of different things, ER, ICU, med tele, oncology. So it's been interesting for sure.
I'm Zachary Sharkness. I have my ADN from here at Salem Community College and also a bachelor's from Grand Canyon University. I currently work, I'm a nurse manager in a hospital for a med-surg telemetry unit and an ICU.
I'm Charles McLeod. I have a doctorate in nursing practice. I'm a practicing APN currently with urgent care. I started as a diploma grad, went forward, got my BSN, MSN through Wilmington University, finished up my doctorate degree with Frontier University, and I started out in critical care after a 3-year diploma program, moved to performance improvement, worked in academia, and currently in urgent care.
Hi, I'm Jim Betancourt. I have an associate bachelor's and master's degree in nursing from Hahnemann University in Philadelphia, and then finally a doctorate in nursing from Grand Canyon University. Currently working with Chuck in urgent care, and I have experience in military nursing as well as oncology and psychiatric nursing as well.
None of you had to start with the BSN program. Some of you started out in a diploma program, others in a community college program. Could you take a minute and discuss why you did not choose a BSN program and why you decided to go to a community college or diploma program?
I decided to go to the community college program. I was actually, it was just Gloucester County College when we went, but then they got bought out by Rowan. Me and Chris went there at the same time. I liked the curriculum that they had offered. Also wasn't, at the time, wasn't really sure exactly where I wanted to go with my career and everything that's going on with it, but it was a good experience for me. I met a lot of friends there. It was a really good program, and even the instructors that I met, they still support me today, even though we've gone in different directions, and some of them don't even work at the school anymore. But overall, it was the best decision that I made for my degree.
Kind of to jump off of what he said, at the time wasn't 100% sure which route I was going to go with this whole thing, but kind of always knew that I wanted to do nursing. So that's part of the reason, but the other part was financially. Substantially, it's a lot less money to go to a community college than it is a big 4-year school, but you still wind up with the same degree, you know. So when you go to a job interview, that kind of resonated in my mind, like, well, if it's the same thing, why am I going to pay double, triple?
Right, you don't feel like you start out as with an associate's degree versus a bachelor's degree. You don't feel like that's held you back at all.
Not one bit.
No.
Okay.
Yeah. So I was a more non-traditional student. I was a little bit older. So definitely finances was like a big part of it. And I live local to Salem Community College, so I chose to come here. I found that it was a quicker path than going straight to a 4-year school because, I was done within a little over 3 years. And I also worked full-time while I was going through it. So being close to home, the travel, the finances, all of it just made, this route much easier for me.
Okay.
And somewhat bouncing off these gentlemen, I also was the first one I found to go to college, and finances were an issue. I'm a diploma grad, and one of the reasons I chose a diploma school was because of more of the clinical rotations and more hours in clinical, as well as the financial component of that. It was 33 months in nursing school with Frankfurt Hospital School of Nursing in Philadelphia. I was supported by the GI Bill. I initially went into the military and got a four-year degree, or excuse me, a four-year enlisted program, and then was able to follow up with the GI Bill, which supplement my income as well, living on my own and being older.
Yeah, I'm going to point out the financial aspect as well. So,
Yeah.
and at the time, I was working as a critical care tech at in the hematology oncology unit at Hahnemann, and they offered the associate degree program. So I thought, let me just get on that first and do maybe a stepwise approach. And also the Montgomery GI Bill with the military helped out as well. So, and then tuition assistance, from Hahnemann helped out a lot. I just thought I would just do that first and then maybe someday look into the BSN program. And I thought I would stop there, but I just kept getting hungrier for more education and pressed on a little bit that way.
Great, thank you.
It is
Okay.
contagious.
It
Your
is.
peer, yeah.